Hello, good afternoon, everyone, and thank you so much for the privilege of your time. My name's Scott Yeager. I am here to help the early childhood education community in Pennsylvania learn a little bit more about Pennsylvania's official health insurance exchange, Pennie. And just a little bit of housekeeping as we head into the call today and today's agenda. First and foremost, this session will be recorded as a resource for the early childhood education community in Pennsylvania. And with that, all attendee lines are muted. However, we do have a question and answer portal, a Q&A portal that's available through MS Teams where we'll have some time here at the end where we can review some questions if you have them. Otherwise, I also put my email address, my contact information in the Q&A. So if anyone needs to follow up on the information, if there are questions, whether it's an organization or whether it's an individual, please don't hesitate to reach out. That's something that we'd be most happy to receive your inquiry. Today's agenda and today's session is going to be brief. However, it's probably going to cover a lot of information that many of you might not be aware of. Um, First and foremost, we're going to talk a little bit about the purpose of today's webinar. We're going to, talk about Pennsylvania's exchange, Pennie, and how we can help. We're going to talk about financial assistance for quality health and dental insurance options. And more importantly, when can people get covered? And another very important factor is no one has to walk a journey alone here at Pennie. So we're going to talk about our resources that we have available. The purpose of today's session is really, it came out of a very recent meeting that Pennie had through the Office of Head Start and our federal partners here in the Commonwealth of Pennsylvania who work alongside early childhood educators. We've also been in contact with our state partners that also work with early childhood educators here in Pennsylvania, and we identified a few different needs that we'll talk about. First and foremost, there are a lot of early childhood educators that are looking themselves for health and dental insurance for themselves, for their families. And that's why our discussion today is going to cover a lot of information specific to that. But also, Pennie works with many small businesses, sole proprietors, and organizations in Pennsylvania who may not be in a position where they can provide group benefits and group coverage for their employees. So with that, we also recognize another important factor, and that important factor is that as early childhood educators, you work hand in hand very closely with young families, with new families here in Pennsylvania, not just the children, but you also do a considerable amount of work with the parents and the community members. So with that, we hope that you find this information beneficial. I'd like to start by addressing who Pennie is and what we do. If you haven't heard of Pennie, don't feel bad. We literally came into existence on November 1st of 2020. Yes, it was during the pandemic, and we became the official replacement for healthcare.gov here for Pennsylvania residents. And in that process, we have helped provide high quality and affordable health insurance plans for the residents of Pennsylvania. But more importantly, and we're going to get into this in greater depth in a moment, is we're the only source for financial assistance that can help reduce the cost of coverage and care. So for a lot of people, knowing that you need health insurance is, it's critical. But there's also a big question, and that big question is, can I afford it? Well, through Pennie, we hope that you'll find the financial assistance that we provide to be beneficial in helping address that concern, or maybe it's a concern of someone you're helping in the community. Um, Speaking of who we help, Pennie is here to help individuals and families without insurance from their employer. Um, right now, as we sit here, there are about 1 in 20 of our friends and neighbors throughout the Commonwealth of Pennsylvania who are uninsured. Um, we are definitely here to help those who utter the words, I don't have insurance, or in some cases, I've lost my health insurance. Um, as a state agency, Pennie has a very close relationship with the Department of Human Services. We have a no wrong door policy. So if an individual, if a family, if they come to Pennie and we're working with them to see what they qualify for here on Pennsylvania's insurance exchange, if it's determined that they may be eligible for medical assistance, Pennie has a warm transfer process where not only are those individuals transferred over to the Department of Human Services, but their application data follows so that they don't have to reinvent the wheel. And what's nice about that no wrong door policy with medical assistance and CHIP is that they also refer uh, a lot of individuals to Pennie to explore their health insurance and dental insurance options. Um, at the bottom of this slide, you can see 374,000 Pennsylvanians who are currently protected under Pennie. That's coming out of open enrollment for 2022. We are now in our open enrollment, I should say still in our open enrollment for 2023. But the most important thing that I can call out here is that Pennie provides customers, 9 out of 10 of our customers, they qualify for financial assistance. So we'll get into that a little bit more here in a moment, but from this perspective, we need to talk about quality and the health insurance plans that are available through Pennsylvania's marketplace, through Pennie, are high quality plans. Those plans cover things like prescription drugs, laboratory services, emergency services, maternity and newborn care, mental health and substance use disorder services, pediatric services. Um, Here's an incredibly important item. At the bottom, you'll see where it says, with the plans that we offer here at Pennie, you cannot be denied coverage due to pre-existing conditions. Now, if you think about someone who might be between jobs or someone who's just lost their access to medical assistance, Pennie can be a very important pathway for those individuals. Also, for younger adults who are 26 and up into the age of 26, they may have been covered through their parents' health insurance. When they age off of their parents' health insurance, Pennie is here to help. Um, and, that's something that any time of year you can reach out to us for. We'll get more into that here in a moment. But I'd like to go back to who we help. Um, the heat map that you see here represents 607,000 uninsured in the Commonwealth of Pennsylvania. You can see the darker the blue, the higher the number of uninsured. Places like Philadelphia, Montgomery County, Lancaster, Allegheny County, Erie, Luzerne, um, Center County. Those are some pretty significant numbers. Again, 1 in 20 wake up every day, go out into the world without the protection afforded by health insurance. And many people know that one of the major factors in individuals and families declaring bankruptcy in the United States and in Pennsylvania are because of unmanageable medical expenses. Pennie's here to help with that. Speaking of help, we're going to talk about financial assistance. And this is really what makes Pennie unique as a health insurance exchange. We're often asked the question, going back to what Pennie is, we are a marketplace. We're not an insurance program. We're not medical assistance. We're not Medicare. We're not veterans benefits. We're an individual health insurance exchange. And if you want to, you could think of Pennie a lot like you would a supermarket, where you would go and have different options and choices. But what makes Pennie unique is we can provide financial assistance to help pay for your health and your dental insurance. Pennie's the only source for financial assistance. We said that a little while back, but it's very important to realize that 9 out of 10 individuals receive some form of financial assistance through Pennie. And that financial assistance comes in two forms. Number one, it's an advanced premium tax credit. Now, what that does is it reduces your monthly health insurance premium. And that's something that really moves the needle in terms of helping people get over the barrier of, I can't afford it. We'll take a look at that here in a minute and what it really looks like. But we also have cost sharing reductions that help reduce things like, co-pays, deductibles, co-insurances. And that can make a big difference too, a huge difference at the end of the day. Because you can have the best health insurance available, but if people can't afford to utilize it, there's really no quality there. And that's where Pennie is very, very different. Our plans are high quality. But Pennie also does other things in order to help make health insurance affordable for individuals here in Pennsylvania. Number one, we provide choice. Not only through our marketplace do we have various health insurance companies that sell their products through us and different options for those products, but we also have metal tiers, gold, silver, and bronze. And here's the thing. All of our plans meet those 10 essential health benefits that we talked about before. And they provide choice. And that's one important factor in helping keep rates and premiums competitive, is providing that choice. Speaking of competition in the marketplace, Pennie does have a competitive marketplace. What's so unique about that is that we work with a lot of the really well-known health insurance companies here in Pennsylvania. And as you can see, we have not only health insurance companies we work with, but we also work with dental insurance companies. And at the end of the day, there's also another program that we have here at Pennie that helps regulate the rates and premiums in the Commonwealth of Pennsylvania, and that's our reinsurance program. So all of that being said, I think it's important that we take a very quick look at some examples of how financial assistance can really make a difference in helping people say, I can afford my health insurance. The first example is an individual makes about $20,000 a year. Okay. Now, one thing I need to say as we go through these scenarios is all of these scenarios are based upon Pennie's benchmark plan, our second lowest cost silver plan in each of these, respective areas. It's really good insurance, and it does make a difference between people just saying, I have insurance or I can use my insurance. Um, in the first example, again, $20,000 a year, the monthly premium, full price, that this individual would pay is $395 a month. After the application of financial assistance, the advanced premium tax credit, that monthly premium is reduced to $0. And yes, some of the plans on Pennie are $0 plans, but that doesn't mean that they're not plans that people can actually use and protect themselves with and their quality of life. We also have some plans that have a $0 deductible. Again, we'll get into how you can get some help in, figuring out what plan's best for you and your family. But we're also going to talk about the middle scenario here. I know this particular webinar is centered upon early childhood educators. However, there are many in our community who do everything right. They work hard, they save their money, and they retire a couple years early. Or they go from full-time work to part-time work or to consulting. Um, the example in the middle shows a significant level of financial assistance for uh, people who need it most. Um, this is a married couple. They're 64 years old. They retired 1 year early. Their gross monthly premium to cover two people is $2,633 a month. That's not a typo. That is a lot of money, especially for an individual or a couple who's heading into what should be a very carefree time of their life. Yet, with the financial assistance through Pennie, their net premium each month is reduced to cover two people to $549 a month. That's a lot of financial savings, a lot. The final example is one that's pretty common for this group. Um, this is a family of four. This family of four makes about $55,000 a year. To cover four people, their premium would be $702 a month. That's a lot of money. But with the advanced premium tax credits and the financial assistance here at Pennie, this family of four can protect four individuals for $92 a month. There are a lot of household expenses, whether it's a cable bill, a cell phone bill, what have you, that could very well cost over $92 a month. But this allows that family of four to protect themselves, their quality of life, and to keep themselves healthy. Here are some other scenarios that I could share with you, or some stats rather, about the impact that the financial assistance here at Pennie has. As we're here today, 1 out of every 4 Pennie customer pays less than $1 a day, less than $1 a day for their health insurance. I don't know the last time you went to purchase a bottle of soda from, or pop, depending upon where you come uh, from a store, but $1 can get you a whole lot more than a bottle of soda these days. Interestingly enough, 14% of Pennie's customers right now are paying less than $1 a month for their health insurance. That's significant. And 40% of Pennie's customers are paying less than $75 a month. Again, there are a lot of household expenses that are way more than $75 a month. So, like I said, our financial assistance has helped so many get protected. Speaking of when you can get protected, right now, Pennie is in our open enrollment period for 2023. Our open enrollment period started on November 1st of 2022 and will be, ending on January 15th of 2023. The important thing to note is that purple line at the bottom. Now, granted, we encourage everyone to try and get covered during open enrollment. However, it's not the only time that you can get covered. During the special enrollment period, which is January 1st to December 31st, those individuals who have qualifying life events, things like getting married, having a baby, losing health coverage, they can qualify for a special enrollment period through Pennie. Now, to talk a little bit about what special enrollment or what qualifying life events trigger a special enrollment period for residents of Pennsylvania any time of year, by the way, it may be something, again, like losing your job-based coverage, losing your eligibility for medical assistance, CHIP, Medicare, what have you. Or, again, as we mentioned before, turning 26 and aging off of a parent's plan. Also, in addition to getting married or divorced, having a baby, adopting a child, having a death in the family. Those types of changes in a household can be qualifying life events that any time of year can open up opportunities for coverage here at Pennie. Also, changes in residence. Let's say someone has lived and worked in Erie, Pennsylvania, or Scranton, Pennsylvania for, the past 5-6 years, and they're offered a new position in Philadelphia or Harrisburg. They have the ability, because they're changing markets in Pennsylvania, to come to Pennie and shop for health insurance. Other qualifying events that are important. Any time of year, those who gain lawfully present status here in the United States, whether they're here on a worker visa, a student visa, here on a path to citizenship, they have the ability to come to Pennie and shop for health insurance. Also, individuals who might be released from incarceration, jail or prison, any time of year, if they don't qualify for medical assistance or some other form of coverage, like health insurance through work, they can come to Pennie and shop for their health insurance. So we are, as an exchange, we're open year round to help people with qualifying life events get protected, because things happen. No 2 days are ever the same. I don't need to tell you that. You work in early childhood education. But a big question that arises is, fantastic. Pennie has health insurance. Pennie has dental insurance. They have financial assistance. But I need help. Well, the one nice thing about Pennie is, like I said before, you're never alone. At Pennie, getting assistance is as simple as ABC. Okay. When you think of Pennie.com, we have a wonderful website. It's educational, it's approachable. Pennie.com is a very easy website for most individuals to navigate. However, um, we recognize the fact that not everybody likes to work online. So we have a contact center here at Pennie. The number is 844-844-8040. Right now, during open enrollment, our call center is open Monday through Friday, 8 a.m., 6 p.m., Saturday, 8 a.m. to 1 p.m. And on January 15th, our contact center is going to be open until 11:59 p.m. During the course of the year, though, our contact center is open to help anybody who has questions, who's curious about their financial assistance or needs help understanding their plan options. They can even help you right over the phone, get insured. Now, the important thing to keep in mind with regard to our customer service center is our customer service center is unbiased. Um, and they can help in English, Spanish. Also, for those whose primary language is something other than English or Spanish, we have a translation line with over 240 different translators available to help anyone whose primary language is something other than English or Spanish approach health insurance in their primary language. But not everybody likes to work online. Not everybody likes to work over the phone. So we have local assistants, assisters, and brokers. Through calling 844-844-8040 or by visiting Pennie.com right on the homepage, you can find out how to connect with a Pennie assister or a broker in your local area. And that's important. Again, assisters are unbiased professionals. They typically work at hospitals, health centers, faith-based organizations, community centers, and are there as a vital resource to help get your questions answered, again, in an unbiased manner. Our brokers here at Pennie are licensed professionals. They are able to help with very complicated questions regarding pre-existing conditions, with regard to making sure that certain medications, certain health facilities, etc., are under your health insurance plan so that your family can maintain your quality of life. So again, if you have questions, this session is being recorded. It'll be available as a resource for the early childhood community here in Pennsylvania. If you have questions, you can reach out to Pennie.com or 844-844-8040. And we can't thank you enough for the privilege of your time. We hope that you and those you work with are safe. And with that, I see that we don't have any questions, but please do keep in mind that this session is recorded. It'll be here as a resource, and so will Pennie. So don't hesitate to reach out if you need help, if you know someone who needs help. We're never far. So thank you so much, and have a peaceful day.